Our next speaker is Dr. Liz Hovey. Now, there's a mass exodus to the bar, I hope. Now, Liz is an oncologist and is currently Senior Staff Specialist in Medical Oncology at the Prince of Wales Hospital, conjoint Senior Lecturer at UNSW and Honorary Associate of the University of Sydney. Liz specialises in genito-urinary oncology and neuro-oncology. That includes prostate, bladder and brain cancer. Liz also set up Cogno, a national brain cancer trial group. She's a distinguished practitioner and researcher. Liz is also, as you will see, an extraordinary person and is here tonight to speak on the health of Australia. Please welcome Dr. Liz Hovey.
Australia's Medicare system was very much modelled on the NHS, launched in the UK in 1948 based on three core principles: that it meets the needs of everyone, that it be free at the point of delivery, that it be based on clinical need, not ability to pay. Consequently, though far from perfect, our system far outstrips most other countries in terms of equitable access to cutting-edge care. Access to both public and private care actually has major benefits. The private system can take needed pressure off our public system for elective surgeries like hips, knees, coronary bypasses, etc. However, if you're really sick, especially if more than one thing is wrong with you, the best place to be is in one of our public hospitals, where many levels of multidisciplinary care can be administered in parallel. We need to be incredibly grateful for our green Medicare cards and the current system, the symbiotic provision of care by medical and allied health teams. Most medical and surgical services currently don't involve a patient having to fork out much money at all, if any. And compared to other countries, our pharmaceutical co-payments are minor, usually less than $50 copay, even if a drug is worth thousands of dollars. As salaried doctors, we can spend as much time with our patients in the public system as needed and prescribe no intervention at all if that is appropriate, rather than worrying we have to be part of a money-making venture. In Australia, we analyse the domestic and global results of gold standard, what we call randomised phase 3 studies, to prove that new drugs are better than existing interventions. Then there's also health economic analysis before something is put on our shelves. It can be an arduous process, but generally a fair way to allocate limited resources. Evidence-based medicine in Australia is the crux of whether an intervention is incorporated into the standard repertoire. Now, over to what we should avoid. I suspect I'm preaching to the converted, but at all costs, we must avoid the adoption of anything resembling the US system. We do not want healthcare to be envisaged as part of the economic machine. Health delivery should be seen as a core element of supporting our community. As Mark says, our health could be thought of as part of our common wealth. Compassionate care is a part of a civilised society. As it's often said, you can learn a lot about a country based on how the vulnerable are treated. The US system is a user-pays system designed for profits. Most people have their insurance tied to their jobs and hence are often stuck in jobs they might not want to stay in. Patients are limited to seeing doctors and seeking services that are in-network, as dictated by that particular insurance. Even those with their insurance in place, the out-of-pocket payments are high and spiralling up. Even a preparation for fungal toenails can set people back over $16,000 a year. Those without cover can have ridiculously frightening bills, with an overnight stay costing thousands of dollars and a stay in ICU millions of dollars. The most common cause of bankruptcy in the US is medical, and I read that up to 42% of cancer patients declare bankruptcy. How crazy is that? A US hospital had a 6-month experiment running free clinics for frequent flyers, diabetics and asthmatics, putting them on a management plan. After 6 months, they had saved this hospital $6 million or so because these patients weren't lobbing into emergency departments in crisis. But the powers that be wouldn't continue to fund this cost-saving free program. Republicans in particular don't seem to understand that a healthy population actually pays more taxes and that it actually benefits everyone to have healthy neighbours. In terms of their public health programs, at Harlem Hospital there was a horrifying cancer clinic with no appointment times, hundreds of people just crowding in at 8 a.m. waiting to be seen without the dignity of an appointment time or of an assigned doctor, and some frightening outcomes. Patients with breast cancers had fungating growths on their chest, not small lumps found on mammograms. Anal cancers weren't diagnosed with a spot of blood on the toilet paper. They were only diagnosed when they could no longer sit down due to the size of the growth. There are more drugs available in America, but at a huge cost, of course, because the Food and Drug Agency, the FDA, can approve the drug without the onerous aspect of paying for it. Now, what should we aspire to? Just a few examples. In terms of public health, we have to bow down to the Scandinavians. Their public health offerings and patient data sets are amazing. They know everything about everyone from birth to death, including drugs and all interventions, and it's all de-identified. They can analyse the success or dangers of any given intervention with astonishing power. Whenever there's a published study with over 100,000 patients, you know, without looking at the list of authors, that they will all have first names like Sven, Annika, Gustav and Bjorn, and likely all be Swedes. Brits have got the best infrastructure for caring for the homeless and run brilliant clinics just for the homeless and their particular needs. UK now has a Minister for Loneliness, which also sounds like it might be a worthwhile initiative and would have health benefits. The French provide excellent medical care for refugees and so-called illegals without any cost for them. Other countries have more of a culture of philanthropy we can perhaps learn from. Also, other countries, including the US, have better infrastructure for research and development. We have a long-standing brain drain of our scientists going overseas to work in well-funded laboratories. We do have a lot to be proud of, but it doesn't mean we can't learn from others. There are both positive and negative lessons to be learnt from our global neighbours. Let's bring our gaze back home to our challenging areas. Probably the most difficult challenge is to disentangle from is the federal-state divide. So the current system, the states pay for our hospitals and the Medicare pays for services outside the hospital, such as bulk billed clinics and PBS drugs. By having the two systems, there is cost and blame shifting and much finger pointing. To give one example, no public hospital has any budget for any chemotherapy. So most cancer centres within public hospitals have to act as private entities and rent space from the public hospital and then pay a huge facility fee to the hospital. We need common sense practice to prevail. The federal government has started to see the light about the importance of research in ultimately saving money. I just recently saw a presentation. There were 25 specific clinical studies in the ICU and newborn setting, which did together cost about $100 million to run, but ultimately and very quickly led to a net saving of $1.3 billion to our system in costs in terms of stopping interventions that don't work and improving outcomes. But at present, the individual state-run hospitals don't appreciate the benefit of research and only can appreciate the costs. And as they have tight budgets to meet, they often get in the way of research happening in their centres. Number two, private system is fragmented. Bills are not transparent. There's no clear line of sight on upcoming expenses for patients, especially in an emergency situation. And many outpatient services are not covered properly. Number three, bulk billing is wonderful on so many levels, but it can be challenging for GPs to make ends meet. The centres which run on the model of 5-minute medicine to turn a profit are really hard for good GPs, and it means that patients who need help with their mental health, for example, often get short shrift, as 5 minutes is way too short to get to any of that content. A good GP is worth their weight in gold. We need to move away from a system that rewards short appointment times with a GP and move to a system that rewards value adding. Number four, one thing that gets my goat, big marquee projects which aren't backfilled with adequate resourcing. New buildings without any money for staff and equipment inside it. New hospitals with closed beds. Number five, frequent freezes on recruitment of staff with no replacements when valued staff leave. Number six, bullying, long hours, poor morale and mental health in some junior staff and others. Number seven, drugs which are developed in Australia, but there isn't the infrastructure for the final phases of development, and an American company ends up with the rights. Neulasta and Surspheres are just two examples. They're both billion-dollar drugs now lining the pockets of Americans after the drug was developed here. Number 8, dentistry is not currently covered by Medicare, which is incredibly short-sighted. Poor oral health has now definitely been linked to higher morbidity, including heart problems and possibly even increased incidence of cancers. Many patients defer going to the dentist due to the costs and fly overseas for cheap dental procedures, some of which can go very wrong. Number 9, our current vexed provision of healthcare to prisoners and also asylum seekers with delayed diagnosis and many other delivery challenges. Moving on to my final but meaty topic. So how might politics intersect with health? Our system needs to be regulated for everything from birth to death, even conception. We need legislation if there's a request to use the sperm of a dead father, complex laws that currently differ from state to state. Childhood health. State government recently voted in favour of providing financial incentives for children to participate in sport. What about the controversial no jab, no play mandatory vaccination policy relating to the importance of herd immunity? The more recent intersection issue of gender, sex change, education and medicine. The prevalence of so-called ADHD and our over-medicated children. The physical and mental health outcomes relating to the digital Instagram age, including issues ranging from socialisation, lower empathy levels, and also issues of bullying and childhood suicide and depression. At the other end of the life cycle, the increase in the number of the aged, the so-called silver tsunami, with Australia expecting more than 2 million people over the age of 85 by 2060, if not earlier. The current Aged Care Commission is an important example of where medicine needs to inform policy. Euthanasia is a very complex and contentious issue where policy is needed to protect both patients and doctors. The current Victorian legislation is flawed and doesn't mandate review of the patient by either palliative care or psychiatry as it stands. We need clarity on the ethics of all aspects of such policies. Apart from the life cycle, there are intersections with all sorts of other challenges that politicians need to think about, whether it's the environment and climate change, or Indigenous life expectancy and Indigenous chronic illnesses. When should the government get involved? When is there sufficient evidence or reason to legislate in favour of a health intervention, like adding fluoride to the water, or a law to wear seatbelts or bicycle helmets? There are things we know to be dangerous, but should we be a nanny state? No doubt that cigarettes are dangerous and cause more disease and health costs than any other substance, the cause of so many chronic and acute conditions. But do we ban it or tax the hell out of it? The controversial issue of harm minimisation in the form of pill testing for party drugs and safe injecting rooms. Do we approve something many in the community don't like for the greater medical good if there's good scientific evidence? Make no mistake, climate change and global warming bring death and disease. Tropical diseases are going to move down to temperate zones. There are diseases that follow hard on the heels of extreme weather events, crises like bacterial infections from the floodwaters. Air, water and soil quality directly impact health. A recent study showed rates of environmental benzenes and certain hydrocarbons were directly leading to breast cancer. Primary prevention and fixing our environment should be major priorities. As in the recent successful Medivac bill proposed by our local independent MP Karen Phelps, politicians should be prepared to weigh in on the health of refugees, including post-traumatic stress disorder, the devastating resignation syndrome, where even young children in these camps are losing hope. Gun control, gambling and drug addiction, all of these intersect with health. You get the idea. There are many challenges, new and old, for our elected leaders to solve. Right now, policy doesn't have the breathing space to develop. As recently as a decade ago, there used to be a logical process where there was a green paper presented with initial thoughts and then potential policies were flagged. Then there were expert debates and input, and this process might take well over a year. Then onto a white paper and then the vote. Gone are those days. At the first whiff of new thinking, elements of the media and those with vested interests eviscerate vulnerable fledgling ideas before they can be adequately researched. The most valuable innovations struggle to find champions. Hard science needs to be given the credit and respect it deserves. Too much weight is given to emotive arguments and comments by non-experts. Towing the party line is valued over the health outcome, and many bills are pushed through without adequate consideration. We need to come up with solutions. Perhaps mandatory education sessions on a bill is a good idea, which ministers and senators need to sign off on having received before they vote for a bill. A thoughtful colleague cautioned the Together Party to keep it simple. Maybe just put forward a couple of simple policies that are easy for the community to rally around in the first instance, like considering putting the provision of dental care onto Medicare and putting more money into pain clinics and mental health. Such interventions will reap dividends as patients and carers can return to the workforce. We need to support the right people to represent us and provoke the public discussions we deserve and put our community interest before political horse trading, backroom deals and appeasement. Bottom line, at the heart of it, our system is quite wonderful. We must treasure and protect our Medicare with eternal vigilance, and let's do what we can to elevate our discussion, our processes and our trusted representatives. Thank you.